Hi, I'm Laura Sikorski, host of Sikorski's Thinkabouts. My guests and I share our operations and technology expertise to help you provide outstanding customer service and customer experience. Today, our guest is Tracy Trypuc, and our topic is patient experience and how it has changed. And Tracy is a registered nurse, but she has also recently received her MBA, Master in Business Administration, and Master in Public Health from Stony Brook University. So congratulations on that accomplishment.
Thank you, Laura.
In addition to that, Tracy is Vice President of the Suffolk County Board of Health, and she researches and discusses and makes recommendations to Suffolk County Legislature, which is here on Long Island, to possibly new legislation and changes. She's also a columnist in Women's Health magazine, and she's also a fellow host here on the Daily Blue Network of Your Health Matters. And she has discussed topics such as child safety, dangers of powdered caffeine, cardiac disease in women, and I can certainly go on and on. But with that, Tracy, thank you so much for sharing your expertise with us today.
Laura, thank you so much for welcoming me on.
So we all know, and here I know a lot of our viewers are international, so you'll have to bear with us a little bit when we talk about healthcare, because here in the United States, we have had something called the Affordable Care Act, and it is something very new for us in the healthcare industry, where there are government regulations. So, Tracy, from your experience thus far with our Industrious Affordable Healthcare Act, what do you think about it?
I personally think that it is a good healthcare act. It was necessary. It came at a time when it had been tried before, and President Obama was, very, eager and good at trying to get it negotiated through. It was signed into law on March 23rd of 2010, and some of the provisions of the act went into effect right away, whereas other provisions were enacted, throughout the later years, through, 2014. What's interestingly right now, it has been fought in the legal realm, but this week we are expecting the Supreme Court of the United States to it has been reviewing it, its status once again, and this time we may be getting a ruling as early as today or sometime this week, and the case this time rests on when consumers who purchase their insurance on the federal exchanges are legally eligible for hundreds of dollars in subsidies that they make, that makes their coverage more affordable. Now, this is only available on insurance marketplaces that are established on the state level. So this is a very important...
It's an important ruling. But for those of us out there who are familiar with the Affordable Care Act, it kind of made us rethink how we are going to look at health insurance.
Yes.
And from the hospital and the doctor's side, there are now penalties that doctors and hospitals are going to get, particularly if a patient is discharged too early and comes back for the same illness.
Yes.
And it's a Medicare patient, as an example, the hospital's not going to get paid. So this is something very different in healthcare. And I also think what has happened as well is the consolidation of our local hospitals.
Right.
We were talking earlier, and there's one of the hospitals that has recently been, it's still in, I think, in kind of an almost signed stage, but they're going to join another hospital system here on Long Island, and that hospital system is going to have over 20 hospitals in it. So that's, again, something very different that's not happened to us on Long Island. And I think the last dynamic is that doctors are becoming hospitalists. Now, what do you think about that?
Well, there's an upside to it, and also, as many things go, a downside. The upside is that it does cause uniformity within the hospital itself. They have their own doctors that work in the hospital, and they see the patients that are admitted to the hospital. So that should reduce some costs, and it makes it easier for a patient to be seen, especially time-wise,
Right.
once they get, admitted and through the course of their stay. Now, the downside is that, many patients have the same doctor through the course of their adulthood, or, even some pediatricians get referred to someone and then, they stay with them. So even though those doctors may have privileges at that hospital, they do not go to the hospital anymore to see their to see their patient load. They end up seeing the hospitalist, and so that could cause initially has caused some patients to be, but I want to see my doctor, and now I'm seeing this total stranger.
Right.
So those are some of the points.
A hospitalist is equally as great a doctor. And
yes, they
what
are.
a hospitalist is they have given up their local practice.
Exactly.
And they have joined the hospital to be the doctor on record for that particular floor or for that specialty.
Yes, and they do, provide discharging,
Right,
and
exactly
let
the same.
that patient's physician know on the outside, what the discharge.
And I think years ago, and they used to call it rounds. Your own personal doctor would make the rounds.
Yes.
And so that's now being done by the hospitalist.
And now the doctor that would have gone to the hospital now has time to see more patients outside of the hospital.
And the other thing that's important with our dynamics here in healthcare is that employers are changing the benefits that they're giving the employees. Years ago, 100% of your hospital benefits were paid for. But because of the cost of insurance, suddenly your deductibles are higher, you're not covered by everything you used to be covered. And we talked earlier, employers are giving money and saying, you go find your own health insurance.
Right, yes,
know?
vouchers.
And so that's, how do you feel about that voucher system? Do you think it's working for us right now, or what do you think?
I think it's too soon to tell about that. I think that it's unfortunate that there are higher deductibles, but employers are making changes, and quite actually frequently, almost on an annual basis, they may make changes to their the insurance company for their employers. So then every year when the employer has to sign up again, they may have to find new doctors again. So this might be what a employee would wish, is to have that money and find their own doctor. But this will have to be borne out in the long term.
Time will tell on that. Well, we are going to break for a commercial break, and we will be right back.
Hello everyone, and welcome to the Daily Blue. I'm Corinne Murphy-Caro, and I'm here to introduce a new show. It is Journey into Awareness with Dr. Richard Journey. Thank you for joining us.
You're welcome. It's nice to be here, Corinne.
Tell us a little bit about what your show is going to include.
Well, my show is going to include inspirational stories about people's journey on their road of life. And the roads are never straight, but they're curved and they meander. So what is it about our journey, and what inspires us to become empowered? Who were their mentors, and what are they doing now, and what do they hope to leave all of us as gifts for each other and the planet? And it's also a show about love, because we all need a little more love in this world to make the world a better place.
Now you bring this from personal experience. You have had your own journey.
Yes,
correct?
I have.
So we're really looking forward to hearing from you about your experiences. I know that you have a very compelling story, and we want you to see us on the Daily Blue. Call us if you'd like to be a guest or if you have some input into Dr. Richard's show, 631-761-9223. Thank you so much, and thank you for joining our team.
You're welcome.
Welcome back. And joining us today is Tracy Trypuc, and we're discussing patient experience. Let's just finish up with wellness. What is that new dynamic now in healthcare?
Well, it's also putting the employee on saying, we're here the employer is here to provide you with health insurance, but you need to give a little back to making sure that you're healthy as well. And like going to the gym, we'll give you some money to help you to go to the gym if you have proof that you've been to the gym, making sure that there's healthy foods in the facility or hospital that you work, incentivizing exercise. So it's a joint commitment.
Effort, right.
A joint commitment to welfare, wellness.
Wellness.
Sorry about that.
So, the patient expectation. I've heard recently the consumerization of the patient is what's happening. And I like to call that shoppers. Years ago, we really didn't look at what the cost of healthcare was. But today, with the way our insurance coverage is going, we want to know how much it is. Have you seen that, with what you've been researching with the Suffolk Board of Health, anything like that?
Yes. Patients would like to know how much different procedures and other things that they are going to have done for themselves, for their child, for their parents, for a family member. They would like to know more. I was saying to you earlier that it used to be a mindset that more elderly patients were afraid to talk to their doctor about the cost of this new medication that they were going to be taking. Now we see that patients do want to know the cost, well, how much is this medication going to cost me? How much is this office visit? There are several levels of an office visit. These are things that are important because everybody's got a shrinking budget at home, and they need to be able to figure out how they're going to be spending this money. So they are going into the patient experience as a shopper with a budget, and they would like to have some answers.
And I find that they're expecting the hospital or their doctor to be just like shopping or going somewhere else for another consumer type of product. So they're expecting very friendly people. They're expecting a wide, different selection of services. So I think that is one of the other things. Patient communications. I find that what's happening now is you want your doctor to be there, or you want, when you call that doctor's office, that you're not going to be put on hold. You're going to get that information, that appointment, that prescription renewal right away. And I think that has happened quite dramatically in this industry. So the patient issues. So we talked a little bit about, getting to reach the doctor. They may not be able to keep their doctors. We talked about that earlier, and that healthcare costs are very expensive today. I find myself, it's difficult to understand the coverage. I know they talk now about co-insurance, and I never had that term before. What have you seen? Both of us have recently stayed in the hospital. Unfortunately, we're fine. But, what have you seen with all of these co-insurance and deductibles?
I know that it is a very confusing experience. There are patients who are aware and there are some that are not. And I really wish that would be one area that they would explain that a little more, but since they're always in a rush, so you often don't know until you get a bill at home and you say, wait a second, but I paid that. These are the two things I find. Either they only bill one insurance and the other insurance isn't on your your sheet that has all your information, or they have them mixed up. So your secondary becomes a primary and your primary becomes a secondary, and both refuse to pay. So,
and then what happens to the patient? The patient is confused and saying, I don't have the money.
And then you have to spend all that time on the phone trying to get it figured out. So, this is a big issue that I think people really need to, and the patient doesn't realize that they're supposed to be explaining this to you because they don't really understand it.
And I think that's unfortunate. So, I mean, how are we going to change that? I don't know. I mean, is it, do we have to change it because of the type of insurance we have? Do we have to call the insurance company first before we go to the doctor?
Well, you should contact your insurance company, and if you do have a secondary insurance, you need to notify them that you have a secondary.
Okay.
And they should be telling you which one is the primary, because you can't really
you
tell
can't
that.
really adjust yourself.
Yeah.
And certainly, Medicare changes and the doctors and the hospitals not getting paid for certain procedures that they used to get before.
Right. Yes.
So I think, some of the general issues that we talked about was, doctors with Medicare reimbursements, no-shows, their own no-show policy. I mean, the monies that doctors are losing based on no-shows or based on abandoned calls in their, for their appointments. I mean, you can be talking $5,000 a day with those on an average.
Whenever you call your doctor's office for whatever reason, I would highly say either for the child of an older parent or the child of a youngster, the parent of a youngster, or just for yourself, keep a spiral notebook and write, today's Monday, it's 12 o'clock and the date, and then say, I tried to reach Dr. So-and-so. And because this way, one thing we didn't talk about is going up the chain of command. You need to let the doctor know that I've tried to call your office 5 times and no one's called me back to make my appointment. They keep passing me off to this one, to that one, to that one. They tell me to leave a message and no one calls me back. So we need to make patients better consumers so that they know what it should be, that what they think they're expecting. Some of the things they're expecting might not be the thing that could happen, but some of the things that they're expecting should happen.
Right. But perfect point. I think also that we're seeing is that technology is influencing. I pulled out of the April AARP bulletin all of these apps that we can go and look, and we can also get ourselves a little crazy, by looking, oh my God, I have a pain, and then thinking we're dying or something. But there are at-home disease monitoring. There's telestroke, fitness devices, the Fitbit. I mean, that's kind of, though you've got your own Fitbit on, right? And it's just, it's amazing how many things technology. I mean, even the fact of video conferencing, your records, and talking to 2 doctors at the same time. So technology, I believe, has greatly influenced.
I would say, just briefly to that, is to make sure that you have signed consent for all parties to have access to your medical records.
To the medical records. Understood. Great point. So let's we always end our show with think-abouts. So, my thought was keep everything in perspective. But your health is the most important thing. So if you don't feel right, you insist. Am I correct in saying? Insist on seeing the doctor. Insist on seeing somebody in the hospital other than who's coming to see you. Never shortchanging your health care. And of course, wellness,
Yes.
which we have
Yeah.
spoken about.
And also, if you don't think that you're being heard, get a second opinion.
Absolutely perfect. A perfect way to end our show. So I would just like to recap to reach Tracy. She is at tracy.trypuc.rn@gmail. She's also on Twitter at Tracy Trypuc RN. And certainly feel free to give her a call at 631-766-7516. For me, your independent call center and customer service consultant. Certainly reach me with a direct message on Twitter or my cell. And of course, we always want to thank Corinne Caro and the
Yes.
Daily Blue for having us on her network, and of course all the staff at Blue Chip Marketing and our videographer Mike. He always does a great job and makes us look wonderful. So to reach them, be sure 631-761-9223. And our guests next week will be representatives from Con Edison, and we're going to talk about the challenges of major technology implementation. So with that, have a wonderful day and a safe day, and we'll see you next week.
Hi, I'm Valerie Graham, and my show is called Natural Bliss. It's all about health, wellness, skincare, keeping yourself happy, healthy, and fit. Join me on thedailyblue.com Tuesdays for a great show and learn a little bit about yourself.